Finance hearing to order. Thank you, members. We all seem to be having some technical difficulties here, so you're on this tiny little laptop over here, and my big screen's over here, so I'm going to be going back and forth. As I said, this is a informational hearing on Senate File 47, and what I think we'll do is go through the bill, have a walkthrough through the bill. As you remember, we did have a hearing on this bill. It was, I think, 4536, and it passed off the Senate floor 45-22 about a month ago. At that time, the total appropriation for that bill was $667 million. Since then, there has been an adjustment to the federal recommendations on what to spend. And Jessica, can you throw up that one piece of paper that shows what we have?
Yes, you bet.
Thank you. So as you can see, the state received $2,186,827 total appropriation because of Hennepin County and Ramsey County's population the threshold that they met of 500,000. They received a direct appropriation to the counties themselves, 300 and almost 17 million, and that was almost 5 weeks ago, I believe. So that left 1.869 billion left. So the calculation from the feds has differed, and that came back about 10 days ago, where it said you can take the 45% of the total 2.186 billion, and that gives us a new allocation for local government for their counties, cities, and townships of 841.464 million. Instead of the 667 million that we were working on. So the difference there is 174 million, and that is what we worked with in a very bipartisan manner with all four leaders agreeing to this. So it was Representative Marquardt on the House side as the chief author, Senator Dziedzic and myself here in the Senate, and Representative Garofalo worked with the Department of Revenue closely to come up with this new bill, which is Senate File 47, that gets the appropriations fairly and quickly and includes the cities and the township of Hennepin and Ramsey's, includes them in the calculation. That's the big difference between the bill, the last bill and this bill, is that we did include appropriations for the cities and township. There's one township, White Bear Lake, in Ramsey County, and we made sure that they got a direct appropriation too, the same as the cities and townships and counties are receiving in Greater Minnesota. However, because of that direct appropriation to Hennepin and Ramsey, there is a big difference between what the two counties and their cities are receiving versus the other 85 counties and their cities and townships. So Hennepin and Ramsey, with their city and one township, they get $250.13 per head, and the other 85 counties and including their counties or their cities and townships receive $184.71. So that was a very big compromise, but we were able to do that to get the money out to everyone. Big differences on how the governor was approaching, and the House too. They wanted to have these large amounts of setbacks. That would have been a very big disparity issue for Greater Minnesota. So we decided to include the cities of Hennepin and Ramsey, and this is what we came up with. With that, I am going to have Mr. Bjorn Arneson go through just the mechanics of the bill briefly, and then we'll talk about two amendments that have come across. So A4 is one from the Department of Revenue for some date changes to make sure that this works correctly with how the mechanics of their department works. And Commissioner Bowerly is online to answer any questions and to fill in the gaps that we don't get. And then the A6 is from the Minnesota, Jessica, help me out here. It was the Association of Intercounties, and that is a liability issue. And we'll go through those amendments. And of course, since this is an informational hearing, we don't have the amendments before us, nor can we adopt them. But I want you as finance leaders to be aware of these amendments that will be coming on the floor, and they will be the same for the House. So we're trying to keep the House and the Senate bill the same. So with that, Mr. Arneson.
Thank you, Madam Chair. I believe members have the bill summary in front of them as well. It was posted on the hearing notice, but maybe I'll walk through the bill text from top to bottom and describe the effect of the bill and the allocation formula. So as the chair mentioned, in concept, the bill spends about $841 million and allocates those resources to local governments throughout Minnesota, including counties, cities, and organized towns. For the purpose of the distributional formula, I think it might be easier to understand if we start from the towns and then talk about the cities and then finally talk about the county allocation. So for an organized town in Minnesota that has at least 200 population, according to the 2018 population count, that town will receive an allocation from the state equal to $25 times that town's population. There are a handful of towns that exceed 5,000 people. And for those towns, mostly in Ramsey and Sherburne County, those towns will generate an allocation equal to the city allowance times the population of that large town. Each city is eligible for an allocation if that city exceeds, again, if that city exceeds 200 in population. And that per capita allowance is calculated under the language of the bill, but the way the calculation falls out with this text is that the cities greater than 200 in population are going to receive an allocation equal to about $75.34 per person. And then finally, the county allocation formula has a couple steps to it. So first, I'm going to find the bill summary itself here. First, the county is eligible at each of the 85 counties that didn't receive a direct allocation from the federal government are eligible for a base amount equal to $121.28 times the population of that county. Additionally, for a county that includes a population residing in towns or cities under 200 or in unorganized areas, that county is going to generate an additional amount equal to $25 times the population of towns under 200 or unorganized areas, plus $75.34 times the population of the small cities in that county. Those small cities and towns have access to financial resources under a process I'll describe later in the bill here. The bill requires the Commissioner of Revenue to begin distributing the amounts to local governments no later than June 30th. Each local government must certify to the Commissioner that local government intends to comply with the state and federal law governing these funds. And those certifications can be accepted beginning June 22nd. These certifications can be provided to the Commissioner on a rolling basis through September 15th, 2020. So for example, if a town or city or county didn't need funds immediately or didn't have eligible expenses immediately, that town or city need not certify immediately. They can wait until they have incurred those eligible expenses or expect to incur them and certify at a later date. But in any case, the certifications must be done by September 15th. The funds can be used for any purpose consistent with the requirements of the Federal CARES Act. And members will know from previous regular session committee hearings that the CARES Act lays out a few broad allowable uses, including that the expenditure is a necessary expenditure incurred due to the public health emergency with regard to COVID, that the expenditure, that the cost was not accounted for in the budget most recently approved by the local government as of March 27th, and that the cost is incurred during the period that begins on March 1st, 2020 and ends on December 30th, 2020. And subsequently to the enactment date of the federal law, there have been some, as the chair alluded, some guidance and frequently asked questions that clarify some of the common questions about allowable uses. Additionally, for a county only, that county must use at least 10% of its base distribution. That's the first part of the county's distributional formula. A county must use at least 10% of the base distribution for emergency financial assistance to individuals and families and for economic support to businesses. And those terms are defined in the definitions section under subdivision 1 of the bill. Last, with regard to counties, I alluded earlier that a small city or town can apply to its home county for reimbursement of costs that small city or town incurs, consistent with requirements of the federal law. And with appropriate documentation to the county has to make a reimbursement to that small local government up to the lesser of $75.34 times the population of that small city, or $25 times the population of that small town, or the town's actual costs. The county, at its discretion, can exceed those amounts, but wouldn't be required to as a matter of law. Subdivision 5 of the bill provides that any eligible county, city, or town can enter into a local collaborative agreement to share resources and perhaps engage with other local governments to maximize the efficiency or effectiveness of this spending. Subdivision 6 governs the expenditure time limits. So as I described earlier, under the federal law, the cost has to be incurred by December 30th. This bill requires that, well, let me break it down by city and county. So beginning with an eligible city or town. For an eligible city or town outside of Hennepin and Ramsey County, on November 15th, if that eligible city or town has funds that are unexpended from these amounts, that unexpended amount has to be transferred to its home county. And in concept, that home county then can use those transferred funds for other allowable purposes at the county level. For an eligible city or town in Hennepin or Ramsey County, again on November 15th, unexpended money for Hennepin County cities has to be sent to Hennepin County Medical Center for their use for purposes allowed under the federal law. And for eligible cities or towns in Ramsey County, unexpended funds must be made available as a grant to Regions Hospital, again, for eligible expenditures under the federal law. And there will be some, as the chair alluded, there will be some clarifying technical language in this subdivision, basically aligning unexpended. Well, you see a couple occurrences of unencumbered, which is a different meaning than unexpended. And so the chair's amendment will make clear that each of these conditions means unexpended. Finally, on the bill text as introduced indicates that there's another deadline, December 15th. It's my understanding that the chair intends to advance that December 15th date to December 1st. So any funds unexpended by the county or by these medical facilities on December 1st would be returned to the commissioner no later than December 10th and canceled to the Coronavirus Relief Fund. And then those returned funds would be available to the administration through the usual LAC process. Subdivision 7 governs repayment of improperly spent federal funds. So the federal law gives the U.S. Inspector General of the Treasury authority to basically audit the spending of local governments. It's our understanding that if a government was found to have spent funds improperly, the Inspector General would seek recoupment from whichever entity first received the federal money. So for Hennepin and Ramsey County, that would be the county itself. And for the state money, that would be the state itself. Subdivision 7 suggests that if the state is subject to federal recoupment because of misspending by a local government that has been distributed funds under the provisions of this bill, that local government, that there's a process established for that local government to repay the state. And that's described here in subdivision 7. And again, as the chair alluded, there is an amendment clarifying that if in the case of a county that provides a reimbursement to a very small local government, if that small local government misspends the money and causes some sort of federal recoupment, there will be language offered that clarifies that it is the responsibility of that small city or town to repay the state, not the county that made the reimbursement transfer to that local government. And finally, the appropriations, again, as the chair indicated, there's $841.5 million appropriated. 55% of that amount is made available for the county level base distributions, and the remaining 45% is allocated under the formulas I described earlier in the bill. And that is a pretty quick summary of the bill text, Madam Chair, and I'm glad to answer questions if there are any.
Thank you, Mr. Arneson. We will go to questions. I do want to recognize Commissioner Barley right now, though, who, welcome, Commissioner.
Thank you, Madam Chair and members.
Thank you. I was wondering if you wanted to just fill in any gaps that we missed or some of the reasonings behind the A4 amendment going from December 15th to the 1st, and then we can go to questions and stand ready for those.
Thank you, Madam Chair. For the record, my name is Cynthia Bowerly. I'm the Commissioner of the Minnesota Department of Revenue. I believe Mr. Arneson covered it, and I just want to thank you, Madam Chair, for working with us on the details of this bill to make sure that it will be administered correctly. I know that is all of our shared goal, and I really appreciate the collaboration over the past few weeks and also the past few days. As Mr. Arneson described, a couple of changes were needed to conform the language with the federal guidance. For example, regions as a private entity cannot receive the transfer funds, they need to receive a grant. And so that is the reason for that language change. The changes around unencumbered versus unexpended, again, seek to conform with that federal guidance, and we appreciate making that clear so we're not, no one is confused as we move towards administering this if it were to be enacted. The date, we appreciate moving the date forward, as I believe all of the members are aware, when the LAC process is used to move funds, there is a 10-day window during which members of that group can provide responses. And so the December 15th date would have put us to December 25th and leaving us very little time for the folks who at M&B who would need to make sure that we could effectively use those funds here in the state of Minnesota. I think we share a goal of not returning any of the federal funds to the federal government and making sure that we can use all of them here in the state of Minnesota. So I really appreciate the work that the staff and the experts at the legislature have done. We appreciate the fiscal staff and the research staff who've been helping us along the way, and of course the reviser. So Madam Chair, that is the nature of the technical suggestions that we have made, and appreciate your accommodation of those so that we can administer it quickly if this bill were to be enacted.
Thank you, Commissioner, and thank you for your work on this. Can you just explain to the committee how the certification and the administrative process will work on this, please?
Absolutely, Madam Chair, thank you. So if this bill were to be enacted, it sets out a timeline for which we would look to make payments. We have been working on a draft certification. We're trying to keep it as simple and straightforward as possible and in compliance with the federal requirements. And about 2 weeks ago, Treasury put out some additional guidance with respect to the administrative side of these funds. And so we will provide that certification to every local government that we have contact information for. We have contact information for every county and city. We do not have email contact information for every township, but we will work with the Township Association to make sure they get that as quickly as possible. We'll also make that certification form available on our website. And then when a local government is ready to let us know that they understand the requirements of that federal money, there are many counties in Minnesota who already have a single audit requirement by the federal government, but this money may tip other counties into that requirement. And so we want to make sure they know exactly what they are getting into when they receive this money. When we receive a certification form from a local government, we will then process that allocation, and we will intend to do this on a weekly basis. As the bill states, if we receive it by the 22nd of June, we will distribute that by June 30th. We will continue on a rolling basis like that through the rest of the summer, through the September 15th date outlined in the bill. I will note for the committee's benefit, and we have discussed this with our local government partners as well, that July is a very busy time in local aids and credits. And so we are distributing LGA, CPA, a number of different aid programs to local governments. And so we will balance this work with that work. We do not want to slow down any of our other statutory responsibilities in distributing aid payments in July. And then we will work with local governments all along the way to make sure they have the information that we need. We will do that in collaboration with our partners at MMB. MMB will be helping ensure that everyone has the information that they need, both to understand Treasury guidance. And so, we will work with our association partners, local government partners, and perhaps convene a WebEx or make sure we have a way to answer questions the best of our ability, and ensure that everyone understands that these are for COVID-related expenses. This is not revenue replacement dollars. We would certainly hope that that is still coming from the federal government, but that is not yet these dollars. And we will work closely with local governments along the way. We know that, for example, under the parameters of this bill, that counties will want to have us keep track of how much is being expended at the city and town level, because they will have need to turn around and spend that money on other eligible expenses when they receive it in November. And then again, the state will do the same in December. So that is our plan. We are looking forward to ensuring we have good open communication with not only the associations who represent local governments, but local governments themselves, and of course, any questions that the committee may have.
Thank you very much, Commissioner. Members, any questions for myself, Mr. Arneson, the Commissioner? We do have 3 testifiers too that I'd like to get to.
Madam Chair, I have a question, but I can wait until the end.
Okay, thank you, Senator Franzen. Anybody else that has, I'm sorry, I don't have your, oh shoot. Oh shoot. Oh. Sorry, guys, hold on. Okay. Almost lost you. So we have Mr. Hilgart from the Association of Minnesota Counties.
Thank you, Madam Chair. Can you hear me?
Yes, we sure can. Thank you, Matt.
Thank you, Madam Chair, members of the Finance Committee. My name is Matt Hilgart, and I represent the Association of Minnesota Counties. AMC represents all 87 counties in the state of Minnesota. Senator, I know you have a long list of testifiers in a short amount of time, so I'm just on here to say today that we are supportive of Senate File 47. I understand it's been quite the journey to get to this point, and I want to give you major accolades for the work that you, Chair Markwart, Senator Dziedzic, Representative Garofalo, and many others have put into this bill over the course of the last couple of weeks. The original $667 million question has become an $841 million question, and I know that the policy and financial considerations and discussions are not easy, even before you weigh input from numerous advocacy groups and testifiers. I don't envy the role that you have, but appreciate that your office has been open to our input over the course of the last few weeks. As members know, local governments are on the front line responding to the coronavirus pandemic. We've testified before in this committee on the lengthy list of items that counties have or are planning to spend money on. For the sake of time, I won't reiterate that list today, but needless to say, it has grown in accordance with the duration of the pandemic. But what I'm hearing most from my commissioners is that aside from covering these costs, counties are most interested in the critical nature these funds have in providing direct relief to residents and business owners. And as many members are already hearing from their own districts, local leaders, and businesses, main streets across the state are hurting. And I know that you've had and heard these stories told by constituents and by elected leaders themselves. In summary, it's critical that members don't just see this bill as reimbursement for local government costs, but as additional relief program that will target individual residents and businesses that are most in need. So in closing, I want to thank you, the Senate, for leading and starting these conversations, your House counterparts, the Department of Revenue, for your hard work on this issue and for realizing the time sensitivity on getting these funds out to do the most good we can. We hope that urgency remains the top interest as we proceed this week and are here to help in any way that we can. Thank you, Senator Rosen.
Thank you, Mr. Hilgart. I really appreciate your work on this too. And there was a lot of hands in this bill. Besides the Association of Minnesota Counties, we have the League of Minnesota Cities, the Association of Townships, the Association of Small Cities, the Association of Metropolitan Municipalities, the Coalition of Greater Minnesota Cities, and the Municipal Legislative Commission. With that, we also have Mr. Gary Carlson, the League of Minnesota Cities, with us today. Welcome, Mr. Carlson.
Thank you, Madam Chair. This is Gary Carlson. May I proceed?
Yes, please. Thank you.
Yeah. Well, again, thank you. As Mr. Hilgart indicated, thank you and the other senators who have been working so hard on trying to develop a system to distribute these important funds to local governments across the state. And we'd like to also thank Commissioner Bauerle for her hard work as well. We've been in about as many meetings with Commissioner Bauerle as we have with you and with Representative Markwart over the past several weeks, and we really appreciate your diligence in trying to develop this proposal. My name is Gary Carlson, as I indicated, and I work for the League of Minnesota Cities, but today I'm also representing the Coalition of Greater Minnesota Cities, Metro Cities, the Association of Small Cities, and the Municipal Legislative Commission, who all asked me to share these same comments with you and the committee. Please note, I think we've also submitted a brief letter outlining our thoughts and ideas about the bill, and you can read that later. I'll try to make a few key points related to that letter. In general, we support the allocation of the full 45% of the state's distribution of the CARES Act funding, or the remaining state share, which would be $841 million. Although this is clearly a very large allocation of resources by almost any measure, we acknowledge that. Please keep in mind that cities and counties provide a wide array of the essential daily services that residents across the state receive from Minnesota government. And we really are committed to providing those services, and this assistance will definitely help us maintain the service levels that we need. We support the distribution of funding on an equal per capita basis among local units of government. And although this bill doesn't quite meet our goal about equal per capita amounts for cities and counties, we recognize the need to get the money out the door soon. And we also recognize that compromises must be found. And as a result, we do support the use of the $841 million and the way this is allocated under Senate File 47. Just keep in mind that as I indicated in a letter I sent to you, Chair Rosenbach, on I think it was April 24th, when you asked us to comment about the direct costs and indirect costs cities are experiencing, those costs have continued to mount, and actually they've probably escalated since April 24th because of the resulting policy actions we've had to take for the pandemic. And also some of the realizations that cities across the state have had to cope with. So we are experiencing lots of costs that really we need the assistance of the state via the CARES Act allocation that is proposed in Senate File 47. Let me just also mention briefly that Treasury has expanded under their definitions the uses of some of this money. And so our understanding of how the money can be deployed has been modified even as recently as the May 28th Treasury guidance update. And we are working with our cities to make sure they understand the types and uses of the funds that they should receive here shortly. But at the same time, the cities have experienced these additional costs. And I know we cannot use the CARES Act money for revenue replacement, but please keep in mind that revenue reductions of cities, and I'm sure counties as well, have started to hit, and it makes it harder for us at the local level to respond directly to pandemic-related costs. So please keep in mind that this money will be used quite quickly by cities across the state. Two quick technical comments about the bill. And I know you're going to have an author's amendment that would counter what I was about to suggest, but I'm going to suggest it anyway. The bill requires unexpended funds to be returned from cities to counties by November 15th. That November 15th date, we understand why it's there, but we also understand that shaves a month and a half off of the ability of cities to use these funds. And we might suggest that you consider an option that would be a little bit different, and that perhaps you could amend the bill to pre-authorize the administration to use any return monies from counties and cities without having to necessarily go through the LAC process. I don't know if that can be done, but if we can try to maintain as much of a window of opportunity for cities and even counties to use those monies, I think it would be very helpful. Because if we have a second wave of this pandemic, if we have additional costs, those are going to occur up to December 30th, and that's going to make it an unavailable source of money for those additional costs. So, Madam Chair, with that, and members, I would urge you, we urge you to support Senate File 47 and the $841 million allocation, and try to do this as quickly as possible. We appreciate all of the hard work by all of the players that have been helping shape this legislation. Thank you, Madam Chair.
Thank you, Mr. Carlson. Really appreciate your work on this too. And we'll talk offline on that other suggestion, because I do understand, but we also wanted to make sure that we didn't leave any money not appropriated either, and that we get that all the CARES Act spent. So we'll continue this conversation.
And Madam Chair, let me assure you that cities understand and agree with you that, and with the commissioner, that we don't want to leave any money on the bottom line and unused by anybody in Minnesota that can use those funds. So thank you.
Thank you. And we also have Mr. Matt Mossman from the Minnesota Inter-County Association. And Mr. Mossman, if you could explain your A6 amendment, and then also how you feel for the Inter-County Association.
Yeah, Madam Chair and members of the committee, thank you for the opportunity to say a few words this afternoon. Again, Matt Mossman, Executive Director of the Minnesota Intercounty Association, which is, just for background, a volunteer association of 14 of Minnesota's mostly larger and faster growing counties. Together, they represent over 1/3 of Minnesotans and nearly 40% of Minnesotans that live in greater Minnesota. And so, like I said, thank you for the opportunity to talk in support of Senate File 47 Senate File 47 provisions to distribute federal CARES Act stabilization funds. The CARES Act was passed by Congress and signed into law back on March 27th, and it included much needed funding for state and local governments. And while it's not a general purpose aid, as has been mentioned, and unfortunately is not available to cover local government revenue losses, it's essential funding that really, I think, does two broad things. It really helps stabilize local budgets and, of course, state budgets as well by covering unexpected direct and certain indirect costs that are due to the pandemic. And it also helps stabilize, and I think perhaps more importantly, helps stabilize communities by supporting the local government actions that are being taken and can further be taken once this money is distributed to help residents and businesses who are directly impacted by the public health emergency. But as we know, state action is needed to get the money out, and counties and local governments, especially for counties and local governments, of course, that did not receive direct allocations. Mike has consistently throughout the course of this conversation, and Madam Chair, and I would echo the thanks to yourself that both the League and the Association of Minnesota Counties, thanks to yourself and Chair Marquardt, Senator Dziedzic, Representative Garofalo, and others, Commissioner Bauerle in the administration and others who have worked to try and help both technically and policy-wise make this allocation of funds work out. We've consistently encouraged that the full amount available to be distributed to local governments be distributed, and that 60% of that go to counties on a flat per capita basis to the 85 counties. And of course, making sure money gets to cities and town partners as well. We've also supported that maximum flexibility in the allowable uses and the timelines, and emphasized that unexpended funds do need to be returned to the state timely to help assist with state costs and funding state budget balance. And so while no compromise is everything that everybody wants, I just think that Senate File 47 largely meets all of these objectives and represents a really good pathway forward for Minnesota and for Minnesota local governments and for Minnesotans in individual communities across the state. Again, I just want to underscore the importance of finalizing the agreement and getting these funds out as soon as possible. As we all know, they're only available through December 30th. And what I can say is that counties are really awaiting doing even more and better things with these funds until they have the certainty that the funds are going to be distributed and at what amount. So you did mention, Madam Chair, the A6 amendment, and I really appreciate your openness throughout the entire process of being open to suggestions and feedback. And the thought here is just that, you know, as one of the compromises, counties have not been requesting to administer the piece for small towns and cities, but are willing to do so. One of the items that we just wanted to suggest, and that is reflected in the A6 amendment, is frankly to help make sure that unreimbursed costs that small towns and cities might be being reimbursed are reimbursed by counties with as little friction, frankly, between the counties, the cities, and their towns as possible. To just, there's going to be some gray area. Frankly, there's a lot of guidance out from the federal government, but this is a very broad potential uses here for the CARES Act money. And so there's going to be uses that are not entirely clear. And we just want to make sure that counties can have the comfort they need to make those reimbursements to small cities and towns, with the assurance that if for any reason those costs are later determined to be ineligible, that the small city or town is accountable for the recoupment of those funds. And so I appreciate consideration of that change. And frankly, I think it'll be, like I said, good for both the small towns and cities who want to make those expenditure requests, as well as for the counties who are administering those funds. That is, in effect, the A6 amendment is just to make that minor adjustment so that it's clear that towns and cities would make those refunds to the state. So, Madam Chair and members, I'll just close. Like Mr. Hilgart said, I won't rehash all of the important needs out there. I think it's also really important and valuable that the bill allows for and anticipates collaboration that frankly is already going on among different levels of local government out across the state to help communities, whether it be small businesses or individuals. And I think that the structure of the bill does that. Recognizes those local partnerships while also recognizing the importance of the tremendous cost impacts that have been out there for local public health departments, emergency housing and rental assistance, telehealth, human service programs, and as we go forward, frankly, reopening licensing centers for counties, supporting social distancing in the justice system as that reopens, as the district courts start to reopen, and potentially, if needed, beyond the HAVA funds to make sure we have a safe election. All of those things, if they're COVID related, are county functions that these funds will be very important to helping out with as needed. And again, we have wanted as much flexibility as possible in the timelines, and we recognize the importance of getting the monies back to the state. So we appreciate the commissioner and your flexibility in setting timelines and a process towards the end of the calendar year that gives us as much opportunity as possible to make use of the funds while still making sure that they can get back to the state as needed. Happy to stand for any questions. And again, just really appreciate your support and leadership on this throughout.
Thank you, Mr. Mossman. I do appreciate you going through some of those expenses too that you reiterated. And I would like to ask Mr. Hilgart or Mr. Carlson too, if they wanted to add to that list of what are eligible expenses, because I know it has broadened since that letter that was sent over a month ago to you all. Any further comments, Mr. Hilgart or Mr. Carlson?
Well, Madam Chair, this is Gary Carlson with the League of Cities. One of the issues that I know that Senator Udke had worked on for us during the session was some funding that would be available to help with the presumption costs related to the workers' comp change under Chapter 72. And that was actually explicitly spelled out in the Treasury guidance as an allowable use of the CARES Act funding. The one challenge we have is that we've had cases. We've had the League of Cities Insurance Trust has had over 200 filed cases related to public safety COVID-related presumption costs. Most of those have been exposure only, and only several have required that the individual be hospitalized, and thankfully there have been no deaths. But at this point, one of those things that we have discussed with the county association is, are we not better off getting the monies out there? And if we have to use those monies after the fact, or up until December 30th for any work comp costs, that might be the most expeditious way to distribute the money. So in other words, not using a dedicated fund, but just using the normal allocation as a way to assist cities and counties with those potential costs. And then the other thing I would just accentuate for Mr. Mossman's comments, public health and public safety salaries under the May 28th Treasury guidance are suggested as presumed to be costs related to COVID response. And when you look at those numbers statewide for cities and counties in terms of the public safety and public health services we provide, those are fairly immense numbers. And we know that that will make the use of the funds readily available for virtually all local governments across the state. So I would turn it over to Mr. Hilgart if he has any further observations.
Senator Rosen, I would echo Mr. Carlson, Mr. Mossman's comments earlier. The only thing that I would add, we are in agreement on the COVID workers' comp issue that Mr. Carlson brought up. A couple of other issues that we've seen kind of percolate through are, as you know, counties are responsible. It's one of our unfunded mandates that we have to provide space and security and technology for some of the courts, for our district courts. And we have gotten recent communication from courts that they would prefer us to put in place certain public health, I would say, infrastructure amendments to their buildings to make it safe for continuing trials in the time of COVID. And so those costs, those infrastructure costs, are something that we anticipate counties will be using these CARES Act dollars for as well. And then in addition to that, also elections and election infrastructure. I know we have two, I know Senator Kiffmeyer and others did a great job on getting HAVA funds out. And we're in current discussions with the Secretary of State's office on how to get those down to local governments. But in the case that those funds aren't enough for kind of preparedness for our elections in both August and November, these CARES Act dollars can be used for that as well.
Very good. Okay. Thank you. Senator Franzen, you had a question.
There you go. To that end, Senator, Madam Chair, I think it'd be helpful to have, I know that's changing constantly, but as good of a list as we can in terms of those expenses so members understand, because I know there's been a lot of confusion, not just along legislators, but I'm assuming cities and counties and the general public of where those dollars are going. So that would be helpful. I'm not sure if that is timely to get it today, but maybe by the end of the special session, getting some sort of a list of what those costs can be, what those dollars can be used for. I'm personally interested in that. My question was more clarifying as well, dealing with section, I think it's subdivision 6, when we have Hennepin and Ramsey County designate unspent funds from this formula to HCMC and regions. I'm assuming those two are the biggest hit hospitals. I'm not sure what the backstory is, why they're there, but if that's the case, I have no problem with that. But I want to make it clear for the record, if in fact counties can provide similar funds to other hospitals within their counties, or is that excluded? Because if it's not explicitly listed in the bill, can another hospital, I know that Bethesda at one point had a high number of COVID cases because there's a COVID specific hospital in Ramsey County, but I'm assuming others around the state. So just want to clarify maybe from Mr. Arneson or legal counsel, can other hospitals potentially get some of this relief through the county or cities or townships?
Well, Senator Franzen, I can answer that too, and then we can turn to our staff also. But this was a piece where we all felt, all four of us that were working on it, the four bodies, that because Hennepin and Ramsey received their direct allotment, that the same formula for the other 85 counties would probably not work. If there was any extra money from Medina or from Richfield, is it fair to send it back to Hennepin County because they got a large chunk already? So it was, we spent quite a bit of time on this. This is actually something that I think is a good idea, to have it go to one of the safety net hospitals within the county. And it just happened to be, there was a lot of talk about HCMC and regions and what was happening. So the other counties went, if they have any extra expenditure or any extra money, at the end it goes back into the CRF fund, the Coronavirus Relief Fund, and then MMB is in charge of allocating that along with the LAC process. And correct me if I'm wrong, Mr. Arneson, but if that's how it is explained in the bill, we do not have any other safety net hospitals, a mechanism in the bill to have that allocation go to them.
Madam Chair, yeah, in the bill text, those two hospitals are the only ones indicated, though I can bring members' attention to one entry in the Treasury FAQ document on page 4 of that document, and maybe I'll just read it for the benefit of members. The question was, to what extent may a government use fund payments to support the operations of private hospitals? And the answer from Treasury was, governments may use fund payments to support public or private hospitals to the extent that the costs are necessary expenditures incurred due to the COVID-19 public health emergency, but the form such assistance would take may differ. In particular, financial assistance to private hospitals could take the form of a grant or a short-term loan. For an example of a strategy that would be responsive to Senator Franson's question.
Madam Chair.
Senator Franson? Yeah, so that's good.
Thank you. So basically it's allowed. It just depends on that local jurisdiction. I just wanted to clarify. I didn't want, no, because we never know what's going to happen from here for a year, and other hospitals become hotspots and we need to support them. So thank you for that clarification.
And
There's
Madam
quite a
Chair,
bit of local control in this bill. Yes, Senator Benson.
to this point, those are community benefit hospitals. They have a specific responsibility for homeless and indigent populations. And so I think it's appropriate that the counties that house those hospitals would have extra consideration. I know HCMC is specifically supported by Hennepin County. That is not the case with Regions. Regions has more independent financial stability and doesn't rely a lot on Ramsey County, but they are similarly situated hospitals with similar responsibilities in our healthcare system.
Thank you, Senator Benson. Yeah, thank you for that. Good question, Senator Franson. Any other thoughts, questions on the bill? Well, wonderful. Well, thank you to you all for being here, and I hope you like the bill. There was a lot of like I said, hands in this bill, and I want to thank everybody that did have thoughts and work into this. Thank you very much, Mr. Arneson, especially you, and Mr. Nauman, who I know is watching, who should not be watching, but he is watching. I want to thank him too. So with that, it's almost 4 o'clock. The meeting is adjourned. Thank you.
Mm-hmm.